What's up guys? Welcome to another episode of The Sky Show. And hari ni kita ada dua tetamu yang agak berbeza sikit. It's a bit different. Both of them have something to do with your gut health. Kepentingan kita punya usus, Dr. Zamir, and another person who is actually going towards a point where this is going to be very relevant. She is doing fasting, and basically she's an expert in doing dry fasting. Can I say dry fasting or wet fasting? I mean fasting in general lah.
Yeah, fasting in general, but dry fasting.
Untuk berpuasa, and there's going to be something more specific untuk wanita, for women, and based on their cycle, ikut diorang punya kita height. Alright, and of course people already know Zamir. Zamir has a very good news coming up. Zamir is going to be coming and working a few days in a week or 1 or 2 days in a week where he's going to be seeing patients. As you know, kita dekat Sky Clinic are more focused towards functional health and regenerative. Badan kita sendiri boleh membaiki. So we, in that idea dengan notion, we are trying to work with people who are in the same mindset, and I'm so lucky to have Dr. Zamir coming and doing and dropping his expertise lah. Dia punya expertise untuk merawat mereka-mereka yang ada masalah lebih kepada macam gastritis lah, GERD lah, apa-apa sajalah, IBS ke, and all these kind of things. And it's also going to be supported with what she does as well. Alright, so without further ado, welcome to the show guys, Divya and Dr. Zamir.
Thank you, Sashi. Thank you for having us.
Yeah. Nice. Actually, we just planned to do it like spontaneously, like both together, all of them together. But yeah, so I'll go with Divya first. Divya, so straight to the point. You are doing fasting. How long have you been doing successfully doing fasting for?
I've been actually fasting for over 10 years, but I've gotten more into dry fasting in the past 3 years. So yes, it's been very successful. Generally, I think I've become a lot younger and feel a lot healthier because of fasting, and now specifically dry fasting.
Okay, so what triggered you to get into dry fasting? Dry fasting is like Ramadan fasting, Dry fasting itu maksudnya dry fasting. So it's like Ramadan fasting. What triggered you to go from just say intermittent fasting or water fasting? I've done a 3-day water fast. That's the maximum I've done before. 3 days water fast. I'm sure you've done that.
Yes.
Yeah, and then you went into dry fasting. What triggered you to get into dry fasting?
Yes, this actually happened during COVID. So when I was in COVID, I had been fasting already for many years, but somehow I wasn't losing weight. I put on weight during COVID. I put on 20 pounds and nothing was working to get rid of it. So then someone told me about dry fasting. I did like a 1-day dry fast. Now dry fasting doesn't have to be done exactly like Ramadan. It can be done for any amount of time. It can be day to night or night to day. So I tried a 1-day dry fast. I lost over 5 pounds. I think at that time because it was also water weight. And then I was like, oh my God, what is this? And over a month, I lost 20 pounds. So that's when I actually first discovered the power of dry fasting. And then I started studying it. And then I created this blog and I wrote all these science articles around it. I now have an ebook and courses. So this was all because of, it was impossible to lose weight, even though I had been normal fasting for a decade. This worked. Dry fasting worked.
So there's a huge difference atau beza dengan fasting menggunakan air dan juga fasting macam Ramadan dry fasting, tapi untuk jangka masa yang lebih panjang, for a longer period. And you lost 5 pounds in the first day.
In one day.
Yeah, so I heard a crazy story from you just now that you've gone really long without water. Right? And I kan, pelik kan? So it's like, how long have you been without water? Like dry, what is the longest?
Water, man.
Yeah, without water.
Well, okay, the longest I've gone without food and water is 9 days.
Gila weh.
This is blowing my minds. Is this blowing your minds? Because it's blowing my mind.
It's a crazy thing, and I'm not saying it's for everyone, but I'm I'm a professional in it. Obviously,
Yeah.
I've trained to do it. I do regular dry fasting as a lifestyle, so 12 to 16 hours every day, almost every day. And then once a week, usually now maybe twice a month because I'm following the female cycle. But
Okay, ikut kita hat wanita lah. So yeah.
yes, but then I practiced it for years. Then I did 3-day dry fast. Then I did 5-day dry fast. Then I did a 7-day dry fast, which is a full stem cell reboot according to science.
Yeah.
And now I've done a 9-day dry fast a few months ago.
So bagi mereka-mereka yang nak tahu lebih lanjut, she got a book and she's also coming up with an app.
Yes.
Alright, we'll get back into that a bit more. Dr. Zamir, In terms of people coming with IBS lah, what are the main complaints that your patients have? Is it weight loss or they come with GERD or IBS or apa yang biasanya diorang main complaints that they come with?
Bloating, hunger, craving yang tak boleh control.
Okay.
And they come along with anxiety, ada yang dah macam dekat nak depression, tak boleh tidur, all that. And yang the first yang I dapat dulu before I embark into the gut health punya benda ni, patient yang ada idiopathic anaphylaxis reaction. So dia tak tahu kenapa dia ada allergic
Reaction macam keluar hives lah kat badan.
hives. Allergic all the time. So dia buat test, boleh kata banyak makanan yang dia allergic. So she came to me. She was referred to me by her from her friend. Kan? So dia kata, you are my,
Savior. I come to you.
my last resort.
Last resort lah. Okay.
So I kata, okay, I will try my best. So memang I spend a lot of time digging history. So she has a lot of trauma all that. And
but you're connecting the mental aspect as well, kan?
yes,
I mean,
yes,
that's very
yes,
important. Yeah,
very important.
Yeah,
So
mind, body.
The history is very important. Lepas tu baru I do my own research. I get to know that gut health could be the problem.
Okay, that was your first trigger lah.
Yeah. Lepas tu I start research. Give her some gut health punya protocol, and then dia start ikut, and then her anxiety, her
Mood swings.
brain fog.
Brain fog.
Actually dia bukan nak lose weight. She's very obese.
Fatigue lah.
Dia kata tak sihat. I want to feel well. Dia kata. I want to feel well, better. So brain fog, dia ada brain fog, ada multiple joint pain. So after she's been following me for after 3 weeks, she lose 8 kilos in 3 weeks. Yeah. 8 kilos in 3 weeks. No more, less joint pain, less brain fog, and she was off from prednisolone because before this dia memang makan prednisolone.
Okay, she was on long term
memang every day dia
glucocorticoids lah. Then that itself can lead to, we know long term steroid use can weight gain, and a lot of other symptoms, bone osteoporosis. So many symptoms that come along with long term steroid abuse.
That's not the solution.
That's not a solution in the long term. It's a shortcut je. We do still use, but only for short term. In the long run, it is actually quite detrimental. To a point where I remember masa dulu I buat locum, ada patient datang, I nak ubat tahan sakit. You sakit apa? Tak tahu, sakit lengan-lengan badan. So I dah biasa datang klinik ni ambil. I don't name the clinic, but it was something which was not nice, and I stopped working in the clinic after that. We used to do locums here and then, and I was like, no, I'm not going to do this. They come over the counter, beli prednisolone, ubat tahan sakit. Saya tengok dia dah ada moon face, dah ada the classic signs of corticosteroid overusage. And I was like, you know what, I am not going to be a part of this, so I stopped working. Even back then, this was like almost like 10 years, almost like 7, 8, 10 years ago. I was like, kita nak buat locum tempat ni.
You ruined it. You ruined it and I'm leaving.
Now, back to this what we do. Would you say that incorporating fasting atau what do you call this, kita berpuasa will be able to reset in terms of your gut health and your gut approach? I'm sure there is going to be a time when you want to give rest untuk kita punya sistem penghantaran makanan, kan?
Definitely. Memang I incorporate fasting in my gut health reset program. So you can do a lot of, all kind of fasting.
Tweaking different types of fasting lah.
Different types. But usually kalau yang teruk-teruk, I encourage them to do 24 hours water fasting. Just one day. And then follow a specific diet that suitable for them. So in the program, I will help them to identify what kind of diet suited for them. So setengah orang mungkin dia buat paleo, setengah orang mungkin kena buat low histamine. So macam yang idiopathic anaphylaxis, I suruh
low
buat
histamine
low
lah.
histamine diet. And then for just maybe about 2 to 4 weeks macam tu. Setengah orang just 2 weeks, maybe setengah orang 4 weeks. And then baru kita start to include more food. because we don't want to be restrictive all the time.
Yes,
kan?
yes. Because we want to go back to a normal lifestyle, and we want them to like just say their aim is muscle gain and muscle mass gain and all
There's
those.
a lot of things.
There is. Divya was telling me that even that can be used during dry fasting. But a huge component of having muscle mass is also infusing water into the muscle, where we do it using, I think a lot of people who go to the gym, they use something called creatine. Right,
Yeah.
so creatine brings the water mass into the muscle and improves on your protein intake and all those. But even if you are someone who's lifting weights, you can safely do intermittent fasting, intermittent dry fasting, in a more, not as long as like 7-8 days or like 3-4 days, but you can do it like a 24-hour or less than like a 18 hours, 16 hours kind of a thing. And that's one way to hack normally when you are like sleeping or something like that, right? Now, based on that, in your app in the future, the app you're bringing into dry fasting, is it going to also incorporate not only women but general? Just say anyone wants to do it for weight loss, a guy wants to do it, and they've got a certain specific aim, goal, whatever. Is that going to be also included inside there, or is it just going to be for women?
Well, currently it's for women, but we are also looking at in the future to get men to do it. Of course, we want men on board as well, but it's following more of the female cycle. So we're looking at how we can make it inclusive.
Inclusive for everyone.
Yeah.
So
So it'll be a bit more the next level.
yeah.
Yeah.
Okay. All right. So yeah,
Because we don't want to miss out the guys.
Yeah.
It's just more of a current approach.
Because I think women, this is basically a very old skill apparently. Dulu masa kita caveman kan dia kata, perempuan dia tahu bila nak makan apa benda.
Yeah.
Apparently.
Yeah.
And even when we were ancient civilizations, after caveman, after all this, when we were already like bercucuk tanam, we were already farmers, women knew what to eat, when to eat, and according to the cycle. I don't know how this knowledge was lost, dah hilang, and now we are thankful that people like you and all those are bringing back this eating cycle based on your progesterone, based on your estrogen, based on your times when you're bleeding.
Yeah.
So all these foods are going to basically help you maintain in that phase and keep your hormone regulation well. At the same time, you don't have to like mati work out just to lose weight and you don't see any result. There's other angles. In fact, food is the first angle that I look at instead of workout. Workout is the second angle, right? Yeah. So once you say you fix the person's gut, the weight loss will happen in a very, very functional way, right? So let me know more how you're going to do this, and we would love to have this app in the future. Coming soon,
Very
right?
interesting.
Yeah.
Yes.
And we would like to incorporate doctors to use this thing, and I think people like Zamir using gut health to improve a person's this one, and we doing more on the hormonal basis as well. We'll be benefiting a lot from these kind of things and all those app and all those. I think for the moment the book is available.
Yes, the book is available. Yes, you can get the book on my website, hackfasting.com.
So we will put the link at the bottom. It's called hackfasting.com, and then you can go and download buku ni untuk baca, you guys. Sebab at the moment kalau kita nak tahu, we are doing more towards precision medicine. Basically di mana we will go towards apa yang you perlukan based on what your body needs. One size fits all doesn't work for everyone.
Yes.
Dah tak ada dah. It doesn't fit anymore.
Betul.
And in fact, when the dry fasting comes, you have to like a general reset, which will work. Biasanya kita we are constantly eating.
Yeah.
We are in a time point where kita sekarang there is no shortage of food, but there's excessive food and excessive processed, constantly available food. Right, this is what the global pandemic is now about. That's the actual global pandemic going on now.
Yeah.
And then of course there's another phase of people who are not getting enough nutrition, but that's a totally different angle. Now what we are covering is more towards the urban dwellers who are macam lebih kurang duduk bandar, kerja, stress, all this is going to affect you, right? So I think that's our show for today. We're talking about fasting. He's got an app, there's a book, there's a website you can go and download to get it done. Ivera.co.
Yes,
Ivera.co.
that's the
IVE.
EVRA.co. MyEvera.co, sorry. And the app is called
Evra?
Yes, like Eve era. It's the
Oh.
eve of a new era.
Okay, so nice,
Because
right?
we want to be new kind of women, you know.
So Evera.
Okay, cool.
Yeah.
So my Ivera.
myevera.co.
.co.
Yeah.
myevera.co is the app. It's
The
not
web-
launched yet.
Yes, but you can get on the wait list.
So you get the wait list, and
Yeah.
then the
Yeah.
website is where you can go and find out. It's hackfasting.com. Dr. Zamir's handle, you guys know. We're going to be making more content on our side based on what he does and all these kind of things. And he's coming into the clinic. We'll keep you posted hari apa Dr. Zamir akan datang dan macam mana dia akan buat dia punya functional medicine kat sini. And I think for today, that's all from us. Thank you very much, guys.
Later.
Thank you so much.
Amazing, amazing.
Oh my God,
Alright.
amazing.
Ciao. See you guys.
Stay tuned.